I am Dr. Manjunath Reddy. Overview of my topic will be, it's kind of talking about what is the causative agent and what is the economic impact of this sheep and goat pox and the status of the disease, physical signs in pictorial diagrams, then diagnosis and how we can prevent the disease. It is a Capri pox virus, the genus name, and pox viridie is the family. This genus has three viruses. One is sheep pox, the other is goat pox, and the lumpy skin disease virus. The first two, that is sheep pox and goat pox, they do some cross-species infections. However, lumpy skin disease virus is very host-specific when compared to sheep and goat pox. It is an enveloped virus. Because of this envelope, it gives a protection to the virus also, and it can be easily be disinfected, or we can kill the virus if you target the envelope. Genomically, or at the level of genes, we can differentiate sheep pox and goat pox. However, serologically, it is quite difficult to differentiate the sheep and goat pox. And many times, even sheep pox or goat pox kits or ELISA kits, if you have, they can cross-react with lumpy skin disease virus also. We don't have many serotypes. We have single serotypes. And we can have a strains of like wild strains. Some we have Kenyan strains, some we have. But as of like other viruses which are segment in nature, like blue tongue or the PPR, where there are quite a good number of serotypes, whereas pox, we don't have many serotypes. Once the cell gets infected, there is an uncoating, and the virus replicates in the cytoplasm. Unlike, it is an exception to the virology, where maximum DNA viruses, they do all the process in nucleus, whereas this virus, it does in the cytoplasm. So that's why you find even inclusion bodies, intracytoplasmic inclusion bodies. And the virus, it's a kind of an adamant virus, which don't grow so easily, unlike the other viruses. Hence, you will be needing somebody who is doing research. They need basically a primary cell culture will be the best, like the lamb testis epithelial cells or kidney epithelial cells, or even the chick embryos. It takes long time to show the cytopathic effect, and sometimes they may not show at all. So in spite of that, you have to go on giving the blind passages. Coming to the impact of the disease, in general, the impact is due to the mortality. This is one of the picture where we took the mortality went up to 40% in a migratory flock, which had around 300 to 400 animals. So once the mortality happens, the direct economic loss to the farmer. Then the second one is due to morbidity. This is kind of a chronic disease where the animal suffers, the skin, the hide is going to be damaged, the body condition itself is lost, so the weight loss of the animal and the treatment cost together adds to the economic losses for the farmer. Then the loss of the production, as I was saying, body condition gets drastically reduced. And in case of pregnant animals, there will be some abortions because of high fever in the beginning, because these pock lesions causes the damage to the hide, and it will be downgraded while grading the skin. The skin cannot be used for the other purposes like leather making or all those things. The fineness of the skin gets reduced. So there is a lot of loss of money there also. Because of the disease, either there will be a local or regional or global trade restrictions or distress sale. So there also is going to have a loss. And some international restrictions. It is because it is also one of the tags. The export of the sheep or goat meat and meat products may be restricted from the countries which don't have the disease of this SGP, sheep and goat pox. Above all, it is an forced unemployment. Once, for example, such kind of disease strikes, whether it is PPR, goatpox, or sheeppox, it's kind of forced unemployment, which leads to the migration. So the consequences are very high. Among the other impacts, like there are all the stakeholders. It's not only farmer who is important for the disease. It is from farmer to pharmacist, from the doctor, from the customer, and in between the traders. Like look at one picture here, what I've seen, it is in Bangalore during that COVID, the supply of the meat. We have seen people standing in queues. Imagine the supply gets reduced. It has an impact on the customer also. So any disease, it's not only the importance is on farmer, it has an effect on the consumer as well as the trader who is connecting the farmer and the customer. So when it comes to the how the disease get transmitted, this is not like FMD or other LSD, lumpy skin disease virus, which are mainly transmitted by insects. This is the disease is transmitted by close contact, and sometimes it is inhalation. Because of this inhalation, organ of predilection in case of sheep and goat pox is lungs, and the second is because it is a epitheliotropic virus, it affects the skin. Through the abraded skin, if you look at if the one infected animal, if you tie to the rough surface, tries to rub it off, the virus or the scabs, they will be staying on the walls or any of the stones nearby or the wooden fencings. So once the other animal comes in contact, when it tries to rub, there is every chance of transmissions. Then the fomites, as I said, the virus is very adamant or it is a very strong virus. It stays a long time in the environment. So the killing of virus is one of the factor to be considered if you want to prevent or control the disease. Then there are a few reports of even mechanical transmission of insects, but it is less likely to occur through the insects when compared to LSD, which is mainly through the insects. Early stages of the virus will be present in all the excretions, whether it is a nasal secretion or nasal lacrimal secretions. So that is where the contamination of the water or the feed happens here also. Because of these secretions, there is a quantum of virus is more. Then the usually short distance transmissions happens because of animal to animal contacts. The long distance transmissions, unlike the other diseases, it is also same where the transportation of live animal is the main route through which long distance transmissions do happen. For implementing preventive or control measures, you should know some of the properties and the virulence of sheep or goat pox virus. It varies, and we have seen even within the same flock, some animals will get more affected, some animals will not get affected. In case of mixed flocks also, whether it is a sheep and goat, sometimes it's only sheep is getting affected. In some herds, it's only goat is getting affected. So it has depends on the virus type and host immune status. Like if it is recently parturited or given the kidding, that animals are more susceptible than the early young ones, and the pregnant or lactating. These things are more susceptible. Then the age where you will find high mortality in case of young ones when compared to the adults, because young ones does not have such kind of robust immunity to fight against this disease. Unlike the FMD or the other segmented viruses, virus cannot be traced by farm to farm spread because it is not that much subject for mutations or all those things. It is susceptible to the temperature at the rate of maybe 55 degree and 65 degree for 30 minutes. If you heat or subject the utensils or the whatever the fomites you had used for the purpose, that can be virus can be inactivated. It is susceptible for alkaline pH also and acidic pH. and some detergents containing lipid solvent. It is susceptible for 20% of ether or even formalin, and like sodium disulfide or phenol. If you use this kind of compounds, you can disinfect the sheds where the outbreak has occurred. Being a field veterinarian, you might be seeing that we are presently using goatpox virus for controlling or vaccinating the cattle against the lumpy skin because of their close relatedness when compared to sheeppox. So again, with some other gene also like RPO30, the goatpox is different, sheeppox is different, and the lumpy skin. Nowadays, there is an species specificity is happening. See, previously we were thought it is goatpox is affecting sheep, both sheep and goat, and sheeppox is also affecting goat and sheep. But we did not see any outbreak which is common for sheep and goat, even though we had herds where their sheep and goat were both reared together. It is a quite interesting phenomenon which makes us to think of going for a vaccination of homologous vaccines. Sheep should be vaccinated with sheeppox, and goat should be vaccinated with goatpox. Host plays a very important role in case of epidemiology or any pathogenesis. Sheep and goat pox, it is cross-infecting, but of late, it is a more kind of LSD where it is a species specific. And exotic breeds are highly susceptible when compared to our native breeds. Subclinical cases, they pose quite an danger or important because they try to spread the disease to the unaffected flocks. The morbidity is very high in case of sheep and goat pox, and mortality is up to 50%. The same thing, LSD, the mortality is very, very less. Morbidity is also very high in case of lumpy skin disease. Both are all pox viruses. Goats, we have seen less severe form of disease when compared to sheep. Sheep, it shows many times a malignant form of disease. So a lot of mortality and morbidity and the severity is more in case of sheep when compared to goats. Some SGPV signs may cause disease in sheep and goat, and there is no carrier status. Once the animal gets infected, here there is no carrier status. Animals gets almost an lifelong immunity. We say because lifelong immunity, we say because usually the small ruminants are kept for 3 to 4 years at the maximum, maybe 4 or 5 years. After that, they'll be slaughtered. So this gives a quite robust cell-mediated immunity, which can stand for the life of sheep and goat. That's why we say it is a lifelong immunity. And SGPV is not a zoonotic disease. Almost all Asian countries, they have a highest burden of the disease, including India. The outbreak density, this side is Ecopratha zones. Disease is more prevalent in southern part of India or in Jammu Kashmir. Like other diseases, it exhibits some seasonality. Rain followed by summer is the main. This is again a 30-year data. It's plotted into simple 1 means January, 12 means December. There is some seasonality of the disease. 2 peaks happens from summer, that is winter ending to the summer. Then once the monsoon starts, 4 to 8, that is up to August, there are 2 peaks of the disease. Clinical symptoms or signs, the incubation period in experimental is less because we are injecting directly into the dermal layers. Usually in natural infections, it is 4 to 21 days. The first sign is kind of a nasal discharge because it's a respiratory infection and lacrimation. Every virus causes high fever. Then the fever is there. The subsequent is definitely an anorexia where the animal tries to avoid the food. Because it is a respiratory disease, you find a respiratory sign of difficulty in breathing. Then you will have a typical pock lesions in the hairless or less prominent hairy portions of the body. Then sometimes the pneumonia gets complicated with bacterial infections. Lameness does happen if it is an lactating mother, there is sometimes secondary bacterial infections leads to mastitis. These pictures, it's an early clinical sign of fever with combined with nasal secretions. Second or third one, the smaller one is late, where it is crusted kind of an appearance. The secretions will be very clear, but it is rich in virus. Nasal swabs are going to be the best material in case of early disease detection, or if you want to submit a samples for labs, nasal swabs in the early signs before the even scabs formations. Because of high temperature, the animal tries to go and find the shading areas, does not like to go to the out of the sun because, as you know, temperature is the main factor. And open breathing you can observe. Then start some nodular regions all over the body. If it is a less arid animal, you can notice very easily this enlargement of lymph node does happen. Then in case of woolly breeds, where the wool fall happens, then if you look at carefully, the lesions will be in early lesions after the fall, erythematous and vesicle, followed by pustule, then scabs. Then you will find below the tail, this is again an early lesions. Then it gets more into kind of vesicles. Then it is below this thigh regions. Then this is a bit aged when compared to the previous one. This starts scabs formations. This is mid lesion, the sheep one, the brown. The black one is later stage or almost recovered animals where the scab is about to fall down. And again, this is also a lost kind of lesion, old lesions, we can say, where you can see the scab can be taken off easily. And this is secondary bacterial infection complicated with the wound of ear. And compared to the goats, in sheep, the lesions are very, very prominent. When it comes to the goats, we don't see such kind of severity as compared to the sheep, but the lesions are more on the muzzle, whereas in case of sheep, you don't find such kind of lesions on the muzzle. Whereas throughout the face, you'll find, on ears, you'll find, whereas on the ear, it is less in case of goat. These are micro observations, and the enlargement of eyes is less in case of goats. Whereas in sheep, you do find a lot of periorbital edema or enlargement of eyes, and the nasal secretions are very, very less, or you may not find many cases in case of goats, whereas nasal secretions are very prominent in case of sheep. In goats, the size of the lesion also, we observed up to even 5 centimeters, the lesion can be recorded in case of sheep, whereas in goats, the size of the lesion is very small, or the diameters are very small, especially in case of lactating or female, this one, no? We could not find many lesions, even though there were lesions on the teeth, more prominent in case of goats. Maybe the size of the teeth, or that might be the one of the factors where you find a lot of lesions on the teeth in case of goats when compared to the sheep. Sheep, we could not find many lesions on the teeth. The mortality in case of goats in kids is maybe the contributing factor, because if you, the moment you find the lesions on the teeth, the probability of allowing the mother for suckling the kid is less when you don't find the lesion. Even if it is suffering also, there will be some production of milk. But when the teeth get epoch lesions, the pain is so severe that it will not allow for the suckling. That leads to inanition, and the mortality may be more in case of kids. The thigh or the lesion size, as I was saying, it is less. On the top of the ear in case of sheep, the lesions are more. Under the ear, the lesions are more in case of goat. This is one of the severe form of pox, where it combined with some other infections, where it was horrible to see the cases, the malignant forms, where it gets complicated with secondary bacterial infections and maggot wounds. These things leads to complications. This is a severe form in case of goat. Goat severe form occurs on the body, when compared to the sheep, where the severe forms are noticed usually in the head region. We have seen the most severe forms in case of sheep, whereas in case of goat, the most severe form is found on the other part of the body, not on the head. One of the typical finding in case of postmortem is gunshot wounds. It is easy to recognize unless you have not seen the first case. It is easy to miss also, to confuse with some bacterial infections, and this lung was from goat. Yeah, I remember. This is from the sheep, and here one more beautiful picture of sheep pox gunshot wounds on the lung. This is the fresh case. The left one, immediately they could conduct the postmortem, and this is the last stage, in the sense it is already putrefaction stage. The animal died way back again, but the lesions are very peculiar, and you can easily identify them. This is one more from the other outbreaks, like a pock lesion. If somebody is a microbiologist, they can say that it is a pock, POCK, pock lesions in case of chorioidal membrane when you infect. No, this kind of lesions is also observed in the laboratory. This is one more case where the animal was already buried. We wanted for the student work, so we took out the carcass by the time so much putrefaction. In spite of that, the lesion was prominent, and we could able to see the pock lesions. If you want to send a sample to the laboratory, what is the best sample for the laboratory confirmation? In the early stages, the blood will have a viremia, and the later stages, if you want to test for antibodies also, the first thing is blood, then followed by, as I was saying, swabs. Whether it is a nasal swab or it is a lacrimal swab, we could detect in lacrimal swabs also. In the mid stages, we have vesicles, where you can take a biopsy or chop off a bit of piece for virus isolations. In the later stages, scabs are the third stage, where scabs can easily come off. This sample may not be that much suited for the virus isolation, but you will have a lot of quantity of virus for detection of with the PCR or nucleic acid detections. The third one, or the last stage, where the scab, you can send it to the nearest laboratory without even any kind of transport media, or even cold chains are not much essential in case of later stages of the disease. Whereas in the early stages, like swab or even the vesicular fluids, you need to take it directly on to the virus transport media, or you can shift them by maintaining the cold chain. But preferably the scabs, there is no need of any preservatives. You can directly take the scabs and put it into a sterile container. You can ship them within 24 hours. There is no need of ice. If you want to long ship, obviously you can put them onto the ice and shift them. Diagnosis is definitely based on clinical science and the history. Then when it comes to the laboratory, we diagnose the disease at Nivedi. We do adapt. First is the virus detection through the PCR, and we differentiate sheep and goat pox by, we have a P32 gene based conventional as well as real-time PCR, in which real-time also we have an cyber as well as probe based for differentiations, and we do sequence, and many of them, if it is a peculiar viruses, we do isolation of the virus through NDBK or BHK or virocells. Of late, we have started sequencing some of the genomes. For sheep and goat also, we are using sheeppox ORF117 based ELISA. This is kind of a population assay wherein our AICRP and advanced, that is animal disease monitoring and surveillance, to understand or to know the burden of the disease, antibody detection is plays a role. Otherwise, it does not have much role, because as I was saying earlier, the sheep and goat pox, it's a cell-mediated immunity plays a major role. So hence, antibody detection has a less importance, but which is important in case of knowing the burden of the disease, as well as whether it is the disease is due to vaccination or the infections. Then we have some pictures to show. This is one of my students' master's work, where you'll find very number of lesions from thrombosis to micro necrotic areas. Then we'll have some bacterial infections. We'll have a beautiful intracytoplasmic inclusions. It is easy to find also. Obviously, we have scored between the sheep and goat pox. We could find a lot of lesion difference between sheep and goat. Then what are the other diseases to be considered for differential diagnosis? Obviously, contagious ecthyma, where you'll find the crusts, and often are less likely you don't find anywhere else the crusts except maybe teeth or where the hairless portions. You don't find pock lesions. It is easy to differentiate. However, if it is a mixed infections, we do get often mixed infections, sheep pox or goat pox with the R. Then we have blue tongue, which has some other lesions. Maybe tongue is blue or the fever. There is no body lesions on the surface, and the edema and the hoofs are the main. Postmortem wise, you don't find much pock-like or gunshot wounds on the lungs. In case of blue tongue or PPR, you'll find congestions or it's kind of an hemorrhagic pictures. And heart, you'll have a good lesions in case of blue tongue. And intestine, you'll have find very beautiful lesions of zebra markings, where the interpest kind of lesions in case of PPR, if you suspect postmortem lesions. And this looks like pox, but is not so. This is an larval migrans, that is parasitic pneumonia. You can differentiate. It's quite easy because there is no other kind of inflammatory signs where you'll find congestions or congested lungs. You find caseous pneumonia, caseous lymphadenitis, and this is a cut surface. Again, this is from the PPR. This is again from the then insect bites. They do respond for the histamines immediately. Coming to the prevention and control, as we know, there is as such there is no treatment for any virus diseases. It's only prophylactic, preferably homologous vaccines, because we are seeing there is less protection among the cross species. If there is no availability of sheep pox with sheep, goat pox with goat, if there is no availability, you can cross use them. There is no harming, but it gives the protection, but not to the level where homologous vaccines do give. Then segregation of the affected animals from the healthy ones. Preferably, they should be given 45 days of separations. This is possible maybe in case of organized farms, it's possible. Whereas the migratory, where they'll have certain kind of temporary fences, they do that. And ring vaccinations, obviously, to avoid or spread further this one. As I was saying, there is no carrier status, so it is easy to control the disease. One other thing is to avoid communal grazing, because it is a mostly close contact disease transmitted. So hence, if you restrict the movement of sheep and goat, you can prevent or control the disease. To treat the comeback of the bacterial, secondary bacterial infections, all of you being the field veterinarians, you are well versed with what kind of antibiotics they work. And the farm level biosecurity practices. This is a very good practice. If you do it in a simple manner, you need not to invest much things like either fencing or separating the animals. All these comes under the farm level biosecurity, vaccinations, regular dewormings, then supplementing with healthy, balanced nutritionals, whether it is mineral mixtures. Nowadays, quite a good number of supplements have also come, which acts in even immune boosters. Then disinfecting the area or the sheds where the pox outbreak has occurred. Then disposal of carcass, like the one this one again is my MBSc student. We asked them to proper burial. Then vaccinating not less than 15 days and not more than 4 months prior to the shipment. If you have planned to purchase or if you plan to ship the sheep or goat from one area to the other area, vaccinate between 15 to 4 months period. That is the best period. Before that or after that, before that it's going to be an vaccine-induced disease because its stress is so much. After 4 months, you don't know whether it is given good protection or those things into the road. You classify endemic versus non-endemic states. In endemic areas, vaccination is the best answer. In case of an outbreak in an endemic area, if it is a small scale one, you can quarantine. If possible, starter can be because infected as well as exposed is non-zoonotic, and he can get some money, some amount instead of losing all the amount. So cleaning and disinfecting and then ring vaccination. If the outbreak happens in an endemic area with large scale, then massive vaccination has to be carried out, whole population. Then we have to implement sometimes a movement restriction or like lumpy skin disease, we do movement restriction in terms of whether animal movement for grazing or even for sales, like closing the shandies or sometimes markets, live animal markets. Such kind of things can be implemented for if it is a large scale outbreaks. Then if an outbreak in non-endemic areas, best way is to quarantine, then starter. Then again, ring vaccination, isolation of the infected herds for at least 45 days for the recovery. With this, this is the last slide of my presentation. There is some practice in some parts of Karnataka where the dead animals are hanged far away from the herds. Their myth or belief is that the other animals will not get affected. So there are some myths and misbeliefs you will come across while implementing this control or preventive measure. Please do take care of them and educate the farmers regarding the disease. Before I close my presentation, I would like to thank our director, Nivedi, and our members like Dr. Yogesh and Chetan. Thank you.